Welcome back, everyone. I'm so glad you're here for today's explainer. We are mapping out something that's honestly a bit complex, but totally crucial to understand: the physical toll of malaria. We're going to break down step by step exactly what happens when this disease hijacks the human body, literally from head to toe. If you're into understanding how things work beneath the surface, well, you are definitely in the right place. We know this is a disease that has shaped human history, right? But if we zoom past those massive global statistics and just look at the individual level, how exactly does malaria take over the human body? What is the actual sequence of events taking place from head to toe? Okay, let's dive into this and check out our medical roadmap. Our main guide today is this really fascinating, dense, bilingual chart from Cambodia Medical Knowledge. It perfectly bridges two diagnostic worlds. On one side, we've got a list of general, early-stage indicators of the disease. On the other, we have an anatomical diagram mapping out super-specific impacts across the entire body. We're going to decode this whole document to give you a complete picture of how this illness presents itself. Section 1. Identifying mild malaria. Now, before we even talk about how a patient actually feels, we have to establish the microscopic root cause. Translated, it simply means the presence of malaria parasites. It's a really important medical distinction to make. The disease isn't just the symptoms you feel. It's the literal, physical presence of these microscopic invaders setting up shop in your bloodstream, way before the physical distress even kicks in. Once those parasites take hold, we start seeing the very first distress signals your body sends out. These are classified as mild malaria symptoms: fever, chills, and joint or body pain. Notice how broad those are? At this early stage, your body just knows something is deeply wrong. It's sounding a huge systemic alarm. The symptoms aren't locked on to a single organ yet. It's just this overarching, full-body warning system firing off.
Part 2. Full-body systemic impacts.
Now, what's really interesting about this slide is how cleanly the pure chaos of an infection can actually be categorized. We've structured the text from the diagram right here. Look at how the central system reacts with a headache, the systemic system throws a fever, and the skin reacts with chills and sweating. The disease isn't just attacking on one front. It's simultaneously triggering your neurological center, cranking up your internal core temperature, and causing your skin, your largest organ, to just wildly fluctuate between freezing chills and intense sweating. Moving slightly further down the anatomy, we can see the physical toll on the muscles and the back, specifically highlighted here as fatigue and pain. And this brilliantly illustrates that exact baseline symptom of body pain we talked about a minute ago. The parasites are causing this heavy, totally exhausting ache that just radiates through the major muscle groups and right down the spine. If we put these two major reactions side by side, we see this absolutely brutal physical contradiction. You've got an internal systemic reaction, the fever, meaning the body is literally burning up, directly clashing with an external skin reaction of chills and sweating, where the patient feels freezing cold. This intense physiological tug-of-war is a hallmark indicator of malaria, and our source captures that dual-layered distress perfectly. Section 3. Localized, organ-specific symptoms. Guiding our attention even further down the anatomy, we can isolate these specific organ reactions, which makes all this dense information a lot more digestible. As the infection progresses, it's no longer just a general ache and a fever. We start seeing really targeted stress happening in the respiratory tract, the spleen, and the stomach. First up, looking specifically at the respiratory system, the diagram notes a dry cough. This adds a localized chest symptom to our growing list. It's a great reminder that even though malaria is a bloodborne parasite, its effects ripple out everywhere, irritating the airways and really compounding the patient's overall fatigue. Then, hidden deeper inside the abdomen, the chart targets the spleen, specifically pointing out enlargement. So, the crucial point is that this disease doesn't just make you feel awful. It causes distinct, measurable, internal, physical changes to your anatomy. Your spleen is working massive overtime to filter infected red blood cells out of your body, and the physical consequence of that intense battle is that the organ itself actually swells up. Finally, rounding out our anatomical tour, let's look at the disruptive impacts on digestion. The diagram clearly labels the stomach's reaction as nausea and vomiting. When you combine this total inability to keep nutrients or fluids down with the heavy sweating we saw earlier, well, you can easily see how fast dehydration and severe weakness can compound this illness. So let's see how this all builds together.
When we overlap those broad baseline symptoms with the specific anatomical impacts, the core takeaways are super heavily reinforced. The fever, the chills, the severe physical pain, they aren't just one-off symptoms. They are confirmed across both diagnostic approaches. It just goes to show exactly how aggressively this disease attacks on multiple fronts all at once.
We've just mapped out a parasite that simultaneously burns your core, freezes your skin, aches your spine, enlarges your organs, and rejects your food. It's intense. So I want to leave you with this thought to reflect on. Knowing how incredibly interconnected our body systems actually are, what is the true compounding impact of these overlapping head-to-toe symptoms over days or even weeks on a patient's body? It is a stark reminder of the sheer resilience of the human body to fight this off, and why understanding the anatomy of an illness is the very first step in defeating it. Thanks for joining me for today's explainer. Keep learning, and I'll catch you next time.